So hello, everyone. For those of you who may not know me, my name is Ed Holmes, Senior Vice President of Equity and Innovation at Overture Center. I'd like to welcome you to this important and timely panel discussion. We've titled The COVID-19 Vaccine and the Black Community. As you may know, during Black History Month, we like to take a look back in order to better determine where we are today and how we intend to move forward with a number of challenges that we find before us. We are excited to have an incredible panel of doctors and community health experts with us who you will meet shortly. They will share their knowledge, expertise, and perspectives on this important topic. Panelists, thank you all for being here today. We really appreciate your time and energy and joining us at Overture Center. In order to keep us focused and on task, my good friend and mentor, Dr. Gloria Ladson-Billings, will moderate today's panel discussion. Because I know this hour will go by very, very quickly, at this time, I'd like to turn it over to our moderator, Dr. Gloria Ladson-Billings.
Thank you, Dr. Holmes. Appreciate the invitation and the opportunity to share, to serve as moderator. I'm going to ask the panelists to introduce themselves as they respond to questions. So rather than take the time to go around the circle, while we know we need to get to some of these questions in this short hour, whenever you first speak will be the time for you to tell us who you are. Dr. Holmes asked me to just kind of set a few things up to give the audience a bit of a context. So I'm going to share my screen. I got about 4 or 5 slides, and then we'll get right into our first question. Okie doke, let's see. And you should be able to see a slide that says medicine and the Black community. Okay, good. Parity and precautions in the COVID vaccine distribution. For those of you who may not know, there are 2 pictures in the background on this slide. One is of the Tuskegee syphilis study. The other is of Henrietta Lacks. Now, I'm not going to go into who they are. I hope that's the question that comes up, but they in some ways play a role in why there may be some, quote, hesitancy in the Black community around the vaccine. There is a long history of medicine and racism. In fact, in 2008, the AMA concluded a 3-year study on the racial divide in organized medicine, and they publicly apologized for their organization's past discriminatory practices against Black physicians. They said that their apology was never intended to be the final word on the subject of race for their organization, but they called it a modest first step toward healing and reconciliation. And one of the things I think is important, they said that as we grapple with the AMA's 174-year history, we must acknowledge the decisions by the American Medical Association leaders that contributed to a healthcare system plagued by inequities and injustices that harm patients and systematically excluded many from our physician ranks. So that's also some of the background that you have to consider as you think about what we are calling vaccine hesitancy. If you look at the pandemic's racial disparity, the COVID-19 deaths per 100,000 people in the US, and this is July, so now we're into 2020. We're now into February, almost March of 21. But back in July, 74 Black or African Americans died for every 100,000 Black or African Americans, as compared to 40 American Indian or Alaskan Natives, 40 Hispanic or Latinx folks, 31 Asians, 30 whites, and 29 Pacific Islanders and Native Hawaiians, and 29 non-racially categorized. So you can see that African Americans far outstripped any other racial ethnic group in terms of morbidity in this COVID pandemic. If you look by selected states, the blue bar shows you the share of the population, and the red bar, the share of the COVID-19 deaths. So in Louisiana, you had Blacks make up 32% of the population of the state, but they were 70% of the COVID-19 deaths. In Illinois, they are 15% of the population, while they are 42% of the COVID-19 deaths. In Michigan, they're 14%, while 41% of the deaths. And in North Carolina is the one state where you see some parity, where Blacks in North Carolina are 22% of the population, and they were 22% of the COVID-19 deaths. If you zoomed in on just Chicago, you see that Blacks comprise 30% of the population in Chicago, but they are 69% of the COVID-19 deaths. So these are scary figures, and it takes us to something that we know is vaccine hesitancy. So in the interest of time, I'm not going to play this video because I actually think we will get most of the questions answered that this video would share with you, but there is something called vaccine hesitancy. And I'm just going to start with some questions that I think people will want to know a little bit about. And so I'm going to start with Dr. Sheryl Henderson and ask the question, whether is the vaccine safe? There have been reports that a number of people are getting really sick after their second dose. So Dr. Henderson, tell the audience who you are and then respond to that question.
Well, thank you. And thank you for the invitation. And it's great to be here with the panel to answer these questions. I'm Dr. Sheryl Henderson. I'm a pediatrician. I'm an infectious disease specialist who's worked with viruses for many years. I work at the University Hospital at the American Family Children's Hospital and have been involved with vaccine studies off and on, and more recently here with COVID. So the question about is the vaccine safe? I know when that question's asked, there's many different ideas of what safety is. And I think about it as, there's sort of three periods of time in which there may be reactions to the vaccine. One is that very first, is there an immediate reaction within the first 15 minutes? And that's rare, that anaphylaxis. But the question alludes to what happens in the 2 to 3 days after getting a vaccine. And what we've found with this vaccine, and there are some other ones too, that the reactions that occur after taking the vaccine is actually your immune response, your immune system responding to a vaccine in the way that it may respond to a virus. So what we found with these two vaccines is the first vaccine, the most common reaction is soreness at the arm or swelling overall. And you might expect that you've just had a needle in your arm. Most people find more reactions after the second dose, and that's often the body has been primed to recognize the proteins, the vaccine proteins that are in your body. And it has developed a response to get after it and fight and try to clear this vaccine. So the symptoms that most people find might be like fevers, chills. Fever is actually a fairly low one. Chills, body aches, headache. But the main thing to know is, number one, it's a reaction to the protein, the vaccine. There's no virus in that vaccine. It's just reaction to part of the part that resembles the virus that you want your body to respond to. So you cannot get COVID from the vaccine, and that these reactions usually last only 1 or 2 days. I had these reactions after the second one. I had the fatigue, the low-grade fever, and body aches, and it lasted for about 24 hours. But it's a natural response. Not everybody gets it. It doesn't mean that the vaccine's not working, but it's when you do feel it, it's sort of like, okay, come on, immune system. We know that there's proteins that don't belong there.
Thank
and then
you,
actually, yeah, that's fine.
Thank you, Dr. Henderson. Now, what I'm going to do in terms of protocol, if you do have questions, I think you can put it in the Q&A function, and I'll try to monitor them so that we can get to questions from our audience. But for this second, and the other thing I will say is, I'll try to start with a different question because I want to try to get to as many of these. But if something from the previous question you feel like it's something that you want to speak on, please feel free to do this. So Dr. Hartman, have treatments improved for those who have contracted COVID-19? And have they had a significant impact on successful recovery? It's a three-parter. And is there equitable access to those treatments for the Black community? So have the treatments improved? Have they had some significant impact on recovery? And are they being equitably accessible? So tell us who you are and respond to as much as you can in those questions.
Okay. My name is Bill Hartman. I'm an anesthesiologist at University Hospital. I'm used to putting people to sleep. So if you fall asleep, I'm not offended. That's my job. In terms of what I do with COVID is I help run several of the clinical trials at UW Health. And so I've been involved with several of these treatments as they have been developed and then moved into emergency use authorization for treatment of people in our community here. Have the treatments improved? When we started back in March, there were no effective treatments at all. And so the bar was set pretty low. But we looked at a treatment that was used in pandemics for the last 100 years, and that being convalescent plasma. And convalescent plasma is the liquid part of your blood that contains all the antibodies. So there's no red cells in it. It's this yellow liquid that contains antibodies. And so when people have recovered from COVID-19, they've got the antibodies to that virus. And since it was successfully neutralizing the virus in one person, they've recovered. We think that you can take that plasma from that person and give it to a person who's sick in the hospital, and hopefully those antibodies will work again and help that person get better. We've seen both anecdotal success, and we've seen results now in national trials where convalescent plasma, when used with high titer, with a lot of antibody, and early in the hospitalization, usually within the first 2 days of the person being hospitalized, we're able to see a decrease in mortality. And that initially had a pretty high administrative burden because it was part of a big clinical trial that was coordinated through Mayo Clinic. And hospitals like University Hospital, who have coordinators and staff people to help get those trials up and running and working, they were able to get access to plasma very easily and get it to patients very easily. Other places that were understaffed, which are often hospitals serving underserved populations, they weren't as well staffed, and it wasn't as easy to get the plasma. And so we, along with folks from Johns Hopkins and Mayo Clinic, pushed very hard for the therapy to go through to the FDA emergency use authorization, which would relieve the administrative burden and allow the plasma to be collected and used at all hospitals for any patient under any circumstance. And so we hoped that would help bridge one of the inequity gaps that we knew existed. As we've moved along, the treatments have even gotten a little bit better. We've moved into the world of monoclonal antibodies, which are cloned from the convalescent plasma, but it's a clean, pure medicine really that works as an infusion. And as the clinical trials grew, we saw that these were very effective in preventing hospitalizations when we gave them to patients as outpatients. We could keep them 75% of the time from having to go into the hospital. And so they've proven very successful there, and they really took on a lot of momentum when President Trump received it after he contracted COVID, and he declared this a cure. It's not necessarily a cure, but it is a very effective treatment. Again, though, these were only present at places where clinical trials were being conducted. At this point, for the outpatients anyway, the monoclonals are available through the same emergency use authorization, so they're available to everyone. There is a limited supply, and so each hospital has its own system of determining who gets the monoclonals, but at least in theory, they are available at all hospitals and available to all people, free of charge at this point, which is really going to have a bigger impact than what we've seen to this point, because again, it's able to keep people out of hospitals. There's some more exciting research coming down the road, and hopefully we'll see another EUA with one of the monoclonals very soon, so that we can expand that program even more. Finally, in terms of the vaccines, 2 of them have been approved through emergency use. They've been shown to be safe and effective. The third one will be approved probably on Friday. Again, another one that's shown to be safe and effective, and good for all people. And we want them to be distributed equitably. I think the states have been struggling with that, and I don't know. I don't have the statistics on hand, but I have a feeling we could do a lot better job than what has been done so far, to both explain what the vaccines are, how they work, the purpose of them, and why we think that people would benefit from vaccination, and then get them into the communities that really need them.
Thank you. And let me tell you, I have really good friends who are anesthesiologists. And so
Good. Everybody needs a friend.
yeah, hey, Dr. Frank Sassy, Dr. Al Kemp,
Sure.
they don't put me to sleep. Okay. Dr. Zapata, you know a little bit about convalescent plasma. I actually have a different question to ask you, but if you want to say something about that, please feel free to. But the question is, what does it mean when we hear the variants are 7 times more contagious than the original coronavirus? So tell us who you are and speak to this question of the variants.
Yes. Thank you for having me. It's just an honor to be here. My name is Dr. Jasmine Zapata, and I'm board certified in pediatrics, but also in the field of preventive medicine and public health as well. I work alongside Dr. Hartman and Dr. Henderson at the UW School of Medicine and Public Health. And this is such a great conversation, so I'm so happy to be a part of it. As far as convalescent plasma, myself and 3 other family members got COVID-19 around Thanksgiving. I found out actually the day before Thanksgiving, I believe, that I had it. And so that was really tough going through that situation. But it was beautiful and a very powerful experience to know that after I recovered and survived, I was able to use my plasma to be a life-saving treatment for other people. And I was able to partner up with a lot of media teams and bring awareness so that others could donate as well. So that was awesome. As far as the variants, there are different variants emerging. And just like any other viruses, we know that over time, in order for them to survive, viruses mutate and change over time. So this is not totally unexpected that we have these variants, but it's something that we're looking at watching very closely so that we can keep up with what's going on. From some of our preliminary studies, we're seeing that some of these variants are changing in such a way that it's easier for them to hide from the immune systems. They're kind of changing their structure a little bit. And the research is still ongoing as it relates to, is the vaccine effective even against these variants? Some studies are showing that there is promise that it is showing still some efficacy against these variants, but then there's other research that is a little more concerning. as far as are these truly going to give enough protection against the variants. Some people are saying that some of the variants could become the prominent strain in the United States by March. So that's why we're really, really watching out for this. There's some of the vaccine manufacturers are even right now working on upgrading and adjusting the vaccine to cover for these variants. So there's a lot in the air right now, but all that to say, we really need to be cautious and continue good hand washing, continue wearing our mask. Even if you do get the vaccine, make sure to continue social distancing because these variants are out there. And actually, right here in Dane County, they have sequenced one of the first variants. So we know that it is in our community.
Thank you. To Mr. Aaron Perry, what do you think we can do to reduce the amount of fear, skepticism, and ambivalence in the Black community about taking the vaccine? I did not show you a slide that suggested that a very high proportion of members in the Black community are saying they're not going to take it. I am scheduled for my second shot next Monday, my husband on Wednesday or Thursday. But each of us, when we went, and we actually ended up going to two different clinics, we're in the same system, but different clinics, we both noticed that we were the only Black people in line. There were long lines, but we were the only Black people in line. So Mr. Perry, tell us a little bit about who you are and what you think we can do to reduce some of this fear and skepticism.
Yeah, thank you so much for inviting me. As I look at this panelist, it's a privilege to be with everyone. But my name is Aaron Perry, and I'm the president and founder of the Rebalanced-Life Wellness Association. We're a nonprofit organization just focused on improving the health and health outcomes for Black men. Also, I'm recently invited to be a fellow with the Health Evolution Forum, which is a forum that's developed for top CEOs in healthcare. So I'm really pleased to be invited to join them. But I opened up the nation's first men's health and education center in a barbershop. And I can tell you that we really believe that in connecting and in a space for Black men where you build trust and you get past all of the shaming and the fears, I believe that that is a space that should be seriously considered as a vaccination place. We've been open for 4 years. We recently surpassed serving 5,100 Black men in our community. Right now, there's 15,600 Black men in Dane County, accounting for 6% of the male population. So we're really pleased that we've connected with about 30% of the Black male population here. In doing surveys, we have noticed that so far, we're hearing more paranoia versus just that deep mistrust. We're hearing guys that they want to be safe for themselves and their families. They want to travel, and they know that what stands in their way is that vaccination. We have been very successful at helping our men understand to do nothing is not an option at this point. And so we're really pleased that our men are hearing that message, but I'm finding that the barbershops just seems to be that space where you can connect with a significant number of men, but you tie into a lot of different factors. And the most important is these clientele, they trust their barbers. They've been with them for so long. And so as the barbers are speaking about, the vaccine, and the barbers are sharing that they are indefinitely intending to get the vaccination, we're finding that it's lowering the temperature a little bit. Now, we still have guys that just flat out say because they have a parent or a grandparent that talks about the Tuskegee experiment. And that's, I don't know how we can get around having some of our elders who are dead set on, I'm not doing it. But we just keep trying to put out a positive message at the shops and encouraging guys to, again, follow the science. we listen to the Dr. Jasmine Zapatas. We definitely are listening to, you know, Dr. Hartman. We've had him on one of our Black male mental health and well-being support groups, and that was very well received. But it's having people come out and just be honest about where we're at. And so that seems to be the key. But again, going back to the surveys that we did with our men, there just seems to be more paranoia than what I would say mistrust. And so that we know, just keep getting the information out, honest, straightforward information. That seems to be the key.
Well, thank you. I actually listened to a podcast last night about the vaccine in the Black community. And it turns out that people who are more closely connected to the Tuskegee study, in other words, they actually had a relative who was a victim of that study, they're lining up for the vaccine. It's, you know, it's those of us who are an iteration away. We heard about that study. We didn't have anybody who was impacted, but we heard about it. And so, no, we don't want to do it. So I think that's really interesting that those people who are really up close and personal with that study are saying that they are going to get this vaccine.
Can I piggyback off that, or can I say a comment about that?
Go ahead.
I read that statistic too, and it was very interesting. And one explanation for that, and I think this is really true, some of the younger generation who has actually lived through some of these racial injustices firsthand, watching George Floyd's murder and different things like that have been coming out, they see that our government is corrupt and is not to be trusted. So if this is the same government that is putting out this vaccine, we're not going to trust them either. I think that is such an interesting dynamic with the recent racial injustices and COVID-19 intertwined. I think that really plays a role in it as well, especially for some of the younger generation who might not be directly connected to the Tuskegee studies. And one thing that I would say, in addition to all that Mr. Aaron Perry said about ways we can get the Black community to trust, one thing that and sometimes I might get in trouble for not, I might not say exactly the right things, but this is truly what I feel in my heart. I believe that it's important for us to talk about the risks and the benefits to the vaccine, but then also the risk and the benefits to not getting the vaccine. What I have seen personally is everywhere you go, everyone says that the vaccine is safe and effective, which it is very safe and effective. However, all vaccines, there is a very, very, very rare chance that you can have side effects like anaphylaxis or and problems like that. And that is a severe life-threatening allergic reaction. So what's happening is that even if that rare occurrence happens, it gets on the news or the media and you see somebody took a video and then that goes viral. So that one very, very rare thing causes a lot of panic because they're looking at us in the healthcare community and saying, look at this, you said the vaccine is safe, you're lying. So my approach has been to be very, very honest and say, hey, let's have a real raw conversation. Yes, the vaccine is safe, but let's talk about these side effects. So for example, the CDC looks, there's a lot of investigation and monitoring on vaccine side effects. And so what we know for anaphylaxis, what we've been seeing over the last month or two is only about 3 to 5 people out of 1 million who get the vaccine have an anaphylactic reaction. Only 3 to 5 people out of 1 million. Okay, it's very, very, very rare. And even the data that they've been looking at since the shots have been going on, from what I've seen, there have been no deaths directly linked to that. Okay, but I also look at the data and say, okay, COVID-19, one out of about 700, I think it's 645, but we'll round it up to 700. 1 out of 700 Black Americans has died from COVID-19. So yes, the vaccine is safe, but let's be real and honest. There is a very, very rare chance you can have a more severe reaction to it. But even that small chance, that does not outweigh the risks of not getting the vaccine and getting COVID. So all that to say, I think it's important as we are addressing our community to talk in a very frank way about the side effects that can come from the vaccine, even though they're very, very rare, so that when they do see that occasional report on the news or something like that, they don't think that we were being dishonest and lying.
Thank you. You know, I was a part of a National Academy of Sciences report on communicating science to the public. And I'm going to tell you, the thing that's scary is that one of the conclusions was that people who have a hardcore value belief about something are almost impossible to convince with science, with data. And the example they use is around vaccinating children. You know, when they get the diphtheria, pertussis, shots, or the polio shots. We know there are a lot of anti-vaxxers, but people, there's no relation. The data show clearly there's no relation between those shots and autism. But if you have an autistic child, you want a reason. And so even though the data stacks up and says, no, that your child didn't get this from getting his shots, it's hard to convince people. And I think that that's one of the things that we're up against with this situation with, as Mr. Perry said, the sort of paranoia. And Dr. Jasmine, you did exactly what we're going to do now. I went around to each of you individually. Now I'm just going to throw a question out, and anybody who wants to weigh in on it, please do. So I'm going to combine a couple questions. This next question is, are all the vaccines created equal? Most of us, the lay public hears Pfizer, Moderna. We've heard a little bit about AstraZeneca, but that's pretty much international. I do know some trials were done here. And now we're hearing that Johnson & Johnson will be out with the one shot that doesn't have to be kept at this ridiculously cold level. Are they all created equal? And then which vaccine do you recommend and why? And I like this question because whenever I've had to have some treatment, I always ask my physician, would you do it? I'm a 2-time breast cancer survivor. So when I had to go through various treatments, I said, is this the treatment you would give your partner or spouse? So are they all created equal? And which one would you recommend and why? So anybody who wants to weigh in, how about speaking up on that one?
Well, are they all created equal? They are created on different platforms. And so they have the same endpoint though. And so the mRNA vaccines, the Moderna and the Pfizer, they react by essentially passing a note to the cells. And that note says to make that spike protein that we then develop antibodies to. The Johnson & Johnson and AstraZeneca vaccines, these are adenovirus vaccines. And so they have a different machinery, but again, the end result is the same, to make that spike protein. And so they go about things differently to get to the same endpoint. That being said, the differences in how these things are made also lends to what would be perceived as the good things and the bad things with them. The good things with the mRNA vaccines, they're extremely effective, 94, 95% effective. The bad things, they are difficult to distribute and to store. They require that extreme cold temperature for long-term storage especially. And so that makes them not as available to certain parts of our country and certain parts of the world. They also are more expensive to make. The Johnson & Johnson and AstraZeneca vaccines, they are very inexpensive to make, and they're very easy to store. You just need like a hotel refrigerator, a small refrigerator to store them, and they'll stay stable. But in terms of preventing COVID-19, they don't get as high a percentage. So where the mRNA vaccines are 95, 96%, these ones are closer to 80%, 75 to 80% effective. And so there's a little give and take with that. The most important thing with any vaccine, though, can they prevent severe disease and can they prevent people from dying? And these vaccines, no matter which one you get, they are very, very effective in preventing people from getting the severe illness associated with COVID-19 and dying from COVID-19, which I really think should be our ultimate endpoint.
Okay. Anybody else want to weigh in on that?
Yeah, I was going to add just a little bit to that. As Dr. Hartman mentioned, there's different types of platforms. The Pfizer and the Moderna are built on the same platform. And what I sat down before, knowing that those would be, one of the two of those would be what's available when it was time to get them, and really read the papers and looked at them side by side. And even though they were developed in different labs, different states, different countries, some differences in protocols, but when you look at them side by side, the outcomes are very, very similar. And I say that to say that that actually, to me, also spoke to the scientific integrity of those particular trials, that the fact that you've had very similar outcomes. So if you're looking at those two vaccines, they are very, very much the same. And they also set a really high bar for efficacy in terms of 94, 95% reducing the chance of mild or symptoms or symptomatic COVID, period. So that anything following that is probably going to be lower. But you know, if you step back, scientists, vaccinologists were going to be happy with 60, 70%. So just even vaccines coming down the road, if they meet that, having a 60, 70% effectiveness against preventing disease or severe disease is still very good. So to answer the question though, if I'm sitting and I'm looking at which one to take, the question would be if there's a choice. But right now, because we know these are under emergency use, they've come out and the goal is to get enough of the population so we can really slow the spread of the virus. The answer really is all of those coming out are safe. They've shown adequate effectiveness. So whichever one is available where you can get it would be the one that I would choose.
Okay, it's interesting because I got one and my husband actually has the other. So whichever one of us gets sick, we'll say, "Oh, see, you should have got the one I got." Mr. Perry made a point of talking about the barbershops as a place that distribution could be occurring and might begin to take away some of the paranoia and fear that people have. And I'm reminded that before moving to Madison some 30 years ago, we lived in the San Francisco Bay Area, and the barbershops and beauty shops actually became a place to distribute information about AIDS, HIV/AIDS. And it's one of the ways that we're trying to kind of stop the spread by getting people much more information and getting people to get tested. Are there other places in the community that you believe we could leverage to get more people to actually take the vaccine? And this is for anybody.
I think one of the toughest things about this virus is that it's really hard to find opportunities to really sit down face-to-face, one-on-one, or one-on a small group of people to really talk about the details. But we have the Zoom platform. But in general, churches, you know, when you think, where do people congregate? Where do they, you know, feel comfortable? Who's trusted? That's one of the first things that comes to mind. And I know that that's, you know, talking with pastors around the city, that they're very active in getting the information on vaccines and distributing it to congregations and people they know.
So So let me combine two other questions here. One is about how long the protection from the vaccine lasts. And the second is, if you've already had COVID-19 and recovered, do you still need to get vaccinated?
I can start with answering those questions and then anybody can piggyback off of me. So for the first question is, how long does protection from the vaccine last? That's still under investigation. It's still under investigation. We're watching these variants very closely to see how much protection we get with the vaccines that we currently have. So there is a chance that it might be something like just like the flu shot, where we have to get the flu shot every year. There is a chance that that will be the case for COVID, but that is still currently under investigation because really the vaccines just came out. People really mass vaccinations just started less than 2 months ago. So we need to be able to follow people over time to see the impacts of that. So the technical answer to that is that we don't know how long the protection will last. And for the question about if you already got COVID-19, should you get the vaccine? What we know right now, according to the CDC, they say that just like we don't know how long protection lasts for the vaccine, we don't know, there is not solid research out yet as far as how long protection lasts with a natural infection. Early reports that came out last year said that there was protection for 3 months, but there was a recent study that just came out that said that it suggested that protection can last up to 8 months, but nothing is set in stone. So what the CDC's guidance is that because of all of those unknowns, and we know that there have been rare reports of people getting COVID-19 in the past and then getting another infection, because there is so much up in the air and unknown right now, the CDC does say if you have had COVID-19, then they do recommend getting, after you recover and your symptoms are gone, then you can get the COVID-19 vaccine. That is what the recommendations are right now. They might change in the future, but that is the recommendation right now.
Anybody else on that one? Okay. If someone's pregnant, should they get the vaccine?
Being the male on the panel, I'll absolutely go ahead and answer this one. The governing body for obstetrics and gynecology has said that pregnancy should not prevent a person from getting the vaccine if they want it. It's still a discussion that they should have with their physician to make sure that there's no other health issues involved here. But the American College thinks, anyway, based on what we've seen from animal studies and from some anecdotal information that we got from both the Pfizer and Moderna studies, where some of the participants became pregnant during the study, that the babies aren't born yet, but we haven't seen any ill effects during the pregnancy to this point. And so based on limited information, but a lot of scientific knowledge, they feel that these vaccines are safe, and especially given that the potential for COVID-19 to wreak havoc during a pregnancy, that the good of getting the vaccine outweighs the bad of getting COVID while you're pregnant.
Okay. I see a question in the chat that says, once you're vaccinated, can you still carry or give the virus to others?
There are several questions where the answer, this is one of them, is that we still don't have that information yet. The trials, the clinical trials that we're looking at, like the Pfizer, the Moderna, were necessarily established to look at the symptom shedding of the virus if somebody doesn't have symptoms. So we don't have that definitive overall. There are studies that are ongoing that are looking at that, and there'll be more information later. But again, so that's another reason, along with these variants showing up, to just really continue to wear masks, hand wash, physical distancing, everything that we've been talking about. Now, I know the CDC is coming out with some qualifications on whether or not 2 vaccinated people can need to wear masks and everything, and that keeps changing overall in terms of guidance. So I think it's important to continue to follow that. And just since I mentioned masks, one thing to mention is one of the new guidances, or maybe clarifications on the CDC, is wearing masks. Is just make sure that they're fitted, because I've had a lot of questions about double masking. And double masking, it doesn't mean you absolutely have to double mask. But if one is wearing, well, the concern is that if you put on one mask, especially like these disposable masks, you can get air leaking out through the sides and through the top. And putting a cloth mask over that that fits along the sides can help prevent that. So the key is really having masks that fit tightly so that you don't have air escaping.
Okay. There's another question that is in the chat that says, I like Mr. Perry's idea about making the vaccine available at barbershops. How would they acquire it? And won't it be more difficult for people who are uninsured to get access to the vaccine? So it sounds like Mr. Perry, we'll start with you on that.
Yeah, so I've reached out to a number of our health partners in the community. I know SSM Health is one. I don't mean to put them out there yet because it's not confirmed, but they are actively looking at ways that we can get our site, the barbershops, as a vaccination site. So that's kind of some ongoing discussions. So that much I can speak to. But I also want to, if I can, just talk briefly about my colleague, Dr. Alvin Thomas, with the School of Human Ecology. He's often talking about that 2 or 3 years following pandemics and the serious mental health problems that often occur following these catastrophic, cataclysmic events like Hurricane Katrina and some of the other pandemics. So I'd like for us to really start kind of woven some of these conversations into that, because we're seeing things like serious mental health illness, including PTSD, but the other thing that I notice, even in the barbershops when I'm there, we're starting to see this significant body mass increases on people that are coming in. So ultimately, we're going to have to start having some of these discussions about how we can really tackle some of that, PTSD and these problems that often follow the cataclysmic events.
Yeah, I
Oh,
think
yes.
that's really important. One of the things that I talk about as children, I've focused more on children returning to school, is the fact that a lot of our children have been through trauma. For example, death, and it's not that children don't know death, but they've had to go through trauma without ritual. So, pre-COVID, if someone died in the Black community, trust me, we have a big celebration. We have lots of people show up for visitation. We have a funeral service, a memorial. We all know funerals are not for the dead, they are for the living. That's our opportunity to come back and make some promises to try to do better. And of course, we have a big repast because, what's the point if you're not going to have some fried chicken and macaroni and cheese? Why are you coming, right? So we have all that great stuff to come together for closure. And yet now we're seeing funerals with 7 or 10 people that don't really represent what our kids are used to seeing. And so that's part of the trauma that I think that some of our folks are experiencing, that they've had to say goodbye to loved ones and friends in a very unconventional way. So anybody else want to weigh in on that mental health aspect of this?
Yes, I definitely want to echo that we're already seeing the ripple effects of this, and we're going to be seeing them for years to come. And it made me think of how excited I am of just looking what platform we're on right now with the Overture Center. And so I hope to be invited back for future conversations on ways that performing arts can actually help to relieve stress and help with this community healing. Right now, there's a long wait list just to get into mental health services. I personally referred 3 people within my personal circle, and they are on wait lists for weeks and sometimes months. And that's what's happening right now. Imagine how worse it's going to get in the future. And especially there's a stigma against going to a one-on-one therapist, even in the Black community. So we need to be thinking about out-of-the-box ways to foster mental health. And out-of-the-box ways are finding out ways you can participate in the arts. There are studies that show that even when you write or you listen to arts or participate in them, it can reduce your stress levels, reduce your blood pressure, things like that. And so I am just really, really excited just that we're on this platform talking about it, because the Overture Center plays a huge role in that and can play a critical role in the healing for our community in the future, even if it has to be virtual.
Mm-hmm. Mm-hmm. So, Dr. Fauci has become all of our personal physician, right? I can't tell you how many times I hear folks start their sentence with, but Dr. Fauci said. And one of the things that I heard Dr. Fauci say is that even once we get all these vaccines in arms, we're probably still going to be wearing masks and still going to be social distancing. What is that about?
I can add, I respect Dr. Fauci, but I'm listening to Dr. Hartman. I mean, he's local, he's white, we can touch him. That's who I'm choosing to listen to. So more power to Dr. Fauci. I'm listening to Dr. Hartman.
And I'm going to take this question in a slightly different direction, but one of the great things that Dr. Fauci has done that it doesn't get enough recognition was when the pandemic started, he put essentially in charge of developing from the NIH side of the vaccines, Dr. Kizzy Corbett, who is a mid-30s Black woman who is going to go down in history as the woman who saved the world, most likely. We don't know her story. Her story doesn't get told very much, but she is the person behind the development of the Moderna vaccine, and is the vaccine that is being used throughout the world at this point, trying to save lives. And so I know that this takes this question into a slightly different direction, but especially in this forum, I think that her work really needs to be highlighted and her name needs to be known.
Well, thank you. Thank you. I'm hoping that the Overture Center will actually do a revival of Miss Evers' Boys, which is the story of the Tuskegee experiment and the nurse, the Black nurse that worked with those men in Tuskegee, Alabama. See if I got another question I want to ask you. We did ask a question.
I can speak very briefly to the Dr. Fauci question and how long we may wear masks while you're looking overall. When you think about it, we've been getting a whole lot of numbers, and one of those is what will it take to reach herd immunity, or and if you break down herd immunity, we hear 70, 80%, and that's the number, the percent of people within a community that are vaccinated. And so when you think about it as community immunity, within one community, you might have 30% vaccinated, and another you have 100% vaccinated. Well, that averages out. If you say, look at the entire state of Wisconsin and you say, okay, we're at 70%, maybe we can stop wearing masks. But you really have to know what's happening within each. So if it's not an even representation. So, when in epidemiology, when you talk about eliminating or, I can't remember, there's many different stages as to when you actually get rid of a virus. And you don't want to be coming from 100% vaccinated there's no virus here community, walk into one that has much lower and the virus is still circulating.
Yeah. And I know that some of us have seen examples of a resurgence of things like measles and polio, all diseases that we thought we were done with, but you get into a community in which people will not vaccinate, and all of a sudden you start seeing the recurrence. We're getting near the end of our time, so I want to ask this question. What will all of this mean for when the Overture reopens its doors for live performances? And would the return of the Black community lag behind that of the general population as a result of the lag time associated with the vaccine distribution in the Black community? So are we going to go back into the Overture Center?
That's a hard question, especially since we just mentioned that the vaccination rate in the Black community is so low and there is such vaccine hesitancy. I honestly don't think it's going to be tied necessarily to the well, hopefully things will change for the future, because that's why we're doing all of this. But the way things are looking now, I don't think that the return of the Black community to the Overture Center is necessarily going to be linked necessarily to the vaccine, but that's just my personal opinion with just looking at the rates now. I just kind of go back to what I said earlier with our community has experienced a lot of hurt and a lot of trauma. And so when there are things for kids to get involved in and ways that we can promote healing and positive mental health, I think actually there will be a lot of positive response. So we really just need to make sure that some of those other measures are in place as far as social distancing, good hand washing, and things like that. So that's a really interesting question. Very complex, interesting.
Yeah, and perhaps one of the indicators we might look for is, are people returning to church? Because that's important to them, and they've been out of churches for about a year, and slowly but surely, I think that there are some churches trying to figure out how to reopen, or they have reentry plans, and whether or not they can actually get folks to come back in.
And so I'm going to jump in here, Gloria, and say we have about 3 minutes left. And I just want to say thank you to everyone for doing such an incredible job tackling this really challenging topic and just being here. I know how incredibly busy you all are, and keeping us healthy and keeping us safe, and it's really meant a lot. I want to just throw it out. If there's anything else for the greater good, anything else that you want to say in closing that you think will be beneficial for us moving forward. I want to give a shout out to Dr. Jasmine Zapata for talking about how Overture Center can be a part of the healing process and the importance of the arts in the community, and just having the opportunity to find ways to reconnect and reduce the anxiety and stress, and the whole idea of just psychological and emotional support that we need as a community and coming back together. And that's a role that definitely Overture can play as we move forward. Any closing comments that anybody would like to share within the next 2 minutes? Okay.
I can add real quick. I have talked with a number of the Black barbershop owners. I'm going to continue to push this. They're all opening their doors to become a vaccination site. Again, let's tap into that relationship between that barber and their clientele. They absolutely trust their barber.
Thank you, Mr. Perry. I kind of skipped over the fact that you talked about all of us putting on these pandemic pounds. But, give us a little bit of space and grace on that. I've been carbo loading since last March.
I think that was done on purpose there, Dr. Gloria Lassen-Billings. I think you skipped over that on purpose. And so I want to again say thank you to everyone. This is being recorded. We will be using this as a part of a forum that we will replay on March 29th. And if there's anyone that you feel would benefit from this, all you have to do is go to the Overture Center website once we get it set up. And you know, they can listen to some of the discussion we had here today, which I think was incredibly informative and beneficial for so many of the communities, not just the Black community for Black History Month, but for many communities as we try to collectively address this pandemic, and how at some point we can come back together, not just at Overture Center, but all, you know, kind of social venues, and come back together as community. And so thank you so much for all your time once again, and look forward to working with you in the future.
Thank you.
Thank you.
Thank you, everybody. Bye-bye.
Bye now.